Donc on l'a compris, il n'est pas toujours facile d'articuler les différentes politiques publiques favorables à la santé, particulièrement dans un pays comme la Belgique où de multiples niveaux de pouvoir se partagent des responsabilités. Mais il y a un endroit qui concentre de nombreux leviers, ce sont les communes. Et comme l'a aussi dit M. Herco, il a insisté sur l'importance de la collaboration avec les entités locales. Depuis 35 ans, l'OMS, l'Organisation mondiale de la santé, encourage les villes à agir pour la santé. Et c'est le réseau Healthy Cities. Alors que nous venons de voter pour renouveler les conseils communaux, il nous semblait intéressant de mettre en lumière quelques expériences étrangères qui pourraient inspirer les nouveaux élus. Et il y en a dans la salle. Et nous débutons ce tour d'horizon avec Kira Fortune, Regional Advisor pour le réseau européen Healthy Cities, qui va nous détailler les missions du réseau. The floor is yours.
So, good afternoon, colleagues, and thank you very much for that very kind introduction. My name is Kira Fortune, as was just said, and I'm the Regional Advisor for Healthy Cities, Health Promotion and Wellbeing at the European Regional Office of WHO in Copenhagen. And I have the grand privilege of coordinating the Healthy Cities Network, and I'm of course also very privileged to have one of our coordinators from the city of Cork with us here today, who will also be unpacking further the work that's really happening at the city level. But of course, I also want to thank the organizers for inviting the WHO to this really, really important conversation. So what I'm going to do over the next 20 minutes is that I'm going to speak to the why, the what, and the how of the Healthy Cities Network. And I'm going to take you on a bit of a journey, sort of looking at some of the challenges that we have at the global level, then talk you through the regional level, and we're then going to hear at the case study from Cork. But I'll also share with you how we are addressing these different challenges as a network. Now, today we have been talking a lot about the future of prevention. And what I've heard is that really at the core of this conversation is that of inequities. And I'd always like to start my presentations with going back to the future, if you like. So going back in the past. And whilst we're thinking about the future, I think it's important to just take a step back and go back to 2015, to be precise. Now, 2015 was a very historic year. It was historic in the sense that the global community concluded the Millennium Development Goals, and it also adopted Sustainable Development Goals. So therefore, it was a time to take stock of our progress. And I think it's fair to say that we could indeed say that much had been done. We saw an increase in life expectancy. We saw a decrease in under 5 mortality, and we also saw a decrease in extreme poverty. But at the same time, there was a recognition that not everybody had benefited equally from this progress. And the fact of the matter is that today, some of the biggest challenges that we are facing as a global community is that of poverty and inequity. And inequities don't just exist between countries, it also exists within countries. If you are a baby girl being born today, you are like in Japan, you are likely to live 32 years longer than a baby girl being born in Mozambique. And if you go to Washington, D.C., I used to live there and I used to commute on this red line on the tube. And what you will see that just within 17 metro stops spanning 30 miles, there is a difference in life expectancy of that of 9 years. So place matters, and it's often said that your zip code is in fact more important than your genetic codes. And it's really important we bear that in mind because, of course, this is where we believe cities, they play a key role to address those challenges. And if we were to zoom a little closer into the European region, our office, we represent 53 member states in Europe and in Central Asia. And we know, and the evidence shows us that every year 1.4 million Europeans, they die due to air pollution. 2/3 of our population, they live in urban areas, and 1 out of 5 children live in poverty. We also know that we are living through what we refer to as a perma-crisis. So we are facing multiple challenges at the same time, including that of climate change, social unrest, as well as that of the pandemic that we have just been living through. To address those challenges, we have put together a European program of work, often referred to as the EPW, and with that, we have honed in on 4 core priorities, namely that of addressing mental health, immunization, behavioral and cultural insights, as well as that of digital health. But of course, this program of work was developed prior to COVID-19. Our world has changed, and we are about to embark on a second iteration of this program of work. Some of you will know that our regional director is Dr. Hans Kluge. He is indeed from Belgium, and he, of course, has a key vision in terms of how we are going to move forward. So we are putting together another program for the next 5 years that will require a lot of consultation, and we would very much like to invite you to join us in those consultations as well. Now, what does this all mean in practice? So we just wanted very briefly to draw your attention to Jana here. Jana is she's a representative of one of our community here in the region. And throughout her very short life, she has been exposed to the health systems on a number of occasions. She lives in a community where there is very poor infrastructure. She has very little access to greens and fresh fruit, and she is exposed to air pollution. As I said, she's been in touch with the health system on a number of occasions, and every time she is treated, and every time she goes back to her community, to the environment that's making her sick in the first place. And again, we want to stress that because central to changing Jana's life will be to address the social, economic, and environmental determinants of health. We just heard from our moderator that the Healthy Cities Network has been around for 35 years. We consider this network as a very strategic vehicle to really address and implement the Sustainable Development Goals as well as the European Programme of Work. And we consider it strategic precisely because at the heart of the SDGs at the heart of our Healthy Cities Network is really that of equity. We work to really address political, we have political commitment, we have the technical excellence, and we have the community engagement, and we draw experience from the past 35 years. So just to share with you that when the network was established 35 years ago, it was really a way to put the Ottawa Charter of Health Promotion into the streets of the people. At that time, the notion that health happens in the community, in the places where we live, where we love, where we work, and these days we also say where we Google, was a very, very novel sort of idea. And it was really just 11 brave cities that came together and decided that they wanted to address those social, economic, and environmental determinants of health. So it started off as a project, and it has since then become a movement. And I will show you the numbers here. You can see now today we work with more than 1,900 cities through our national networks and through our flagship cities. And we estimate that we impact the lives of 237 million people in this region alone. And I should also say that we, of course, we are just one region out of 6. So we also work very closely with colleagues around the world. So you can imagine 6 regions put together with this type of network is quite powerful. So our Healthy Cities Network, what is it that we do? So we are very much a platform for knowledge exchange, and we come together every year. All of our cities, all of our national networks, they come together every year where we conduct our annual business meeting, where we take stock of the progress that we've made, but also plan for the following year. But importantly, we also come together to really showcase the work that's being done at the city level. And this is an opportunity for all of our cities to come together to, again, not just showcase what they've done, but also take stock of the challenges and think very concretely how to address those challenges in often a collective manner as well, because of course what's so unique about the network is that the cities come together on a regular basis, they convene, they learn from one another through various meetings, workshops and whatnot. We also facilitate partnerships, and as I said, we don't just work in the region of Europe, but also across. Just last year, we had a very specific request from members of our political committee that they were keen to learn about the green zones and the blue zones from Japan. And as such, we did an exchange where we learned from one another and took those lessons learned and applied it more broadly in one of our piloting that we are currently doing on the well-being economy. We also do policy and advocacy and really built capacity. We have just recently, again, launched a training course on the 20 steps on how to become a healthy city. And again, this was something that we co-created with people like Denise, as well as with other colleagues from across the network. And that is a course that's available globally and available to all of you as well. And we, of course, welcome you and invite you to do the course. So, as I said, we have been around for 35 years. We work in 5-year program cycles, and every 5 years we take stock of the work, and every 5 years we decide on what to hone in on. Currently, our program cycle is really honing in on what we refer to as the 6 Ps. You will know the 5 Ps from the Sustainable Development Goals, which is people, prosperity, peace, participation, and we have added an additional P, which is that of play. So these are the 6 Ps that the cities are working to address during this program cycle. And we are just about to come to an end to our 5-year program cycle. So again, what we will do is that we are conducting an evaluation, looking at the way we are governed as a Healthy Cities Network, looking at the impact that working and being part of the Healthy Cities have made over the past 5 years, and also looking at how the world is changing and how we as a network are positioned to, again, being able to work more in a more aligned manner with those other Healthy Cities networks that are out there. Now, to ensure that we, again, capture all of this, we have recently launched a data hub, and the data hub was just launched on the 6th of November. This is really capturing all the data from the past 35 years, as well as all of the priorities that all of our cities, they have put out there when they became a member of the Healthy Cities Network. It's still work in progress, but the next step is also to really capture all those good practices. We've just heard a number of those during the dialogue this morning, and we're about to hear from Cork as well. But it is really, we consider this very much as a as a wealth of knowledge, because in there you will be able to again look at the how-to and understanding different ways that cities are implementing the work. And I should also say that this data hub for now, it's available for our members. And we are, of course, also in dialogue with members of our advisory board to look at how we can perhaps consider opening this up so this information will also be available more widely. So again, I just want to share with you that our sort of key commitment through the different program cycle, through these 35 years of history, is really to, again, change Jana's life and create a setting where Jana don't just survive but also thrive, where she breathes clean air, where she has access to greens, and where she feels secure and safe, and where she has access to green parks, including that of community gardens, which we will also hear more of from Cork. And we know that in order to do that, those challenges that Jana is facing cannot be tackled by one sector alone. It really requires different sectors to come together. And again, that's where we also are seeing the benefits of the Healthy Cities Network, because we know that those local politicians, really they have deep knowledge of their communities. Again, we often say that their bread and butter is really working across sectors. And many of the social, environmental, and economic determinants of health really fall under their local domain. So again, they're really well positioned to, again, change Jana's story so that she doesn't just survive, but also thrive. Now, concretely, we also come together, and just 2 years ago, our member states came together to discuss the role of the economy of well-being. And this was really a way to look at how we can move beyond GDP and really hone in on the well-being of people, putting people's well-being and planetary health at the center of all policies. During that meeting, we had a lot of our members represented, and a lot of our mayors say, look, we are already doing this, and we want to showcase how that can be done. And often cities are very agile, so we decided to put together a piloting. And this just happened last year in June. We've been working with 8 cities. You can see them listed up here. And the 8 cities come together on a regular basis. They have all identified and selected different sort of areas of focus, but they all speak to the economy of well-being. And this is very much a journey where all the cities are learning from one another, and we are creating this sort of list of best practices so that we have something concrete that other cities can then take on board, and so that they can also apply this moving into the future and as we start thinking about scaling up. We have many examples of how this is done in practice. There is a lot of focus on participatory budgeting. We're seeing examples of that from across the world, both in Brazil, in the Philippines, and in Kenya. And in our region, Bruno has been very much a champion of the participatory budgeting approach. And again, what they have done is that they concretely, every year, they put out a bid to the community, and the community put in proposals as to how they would like to allocate the funds for their city. The bids, the proposals are then evaluated by the authorities. They take into account the budget, the legal matter, and the sort of how best to implement this. And once that assessment is done, it's being put out there. and the community has the opportunity to vote for the best initiative. This has been going on for 7 years now, and this year the best initiative that was voted for by the citizen was a nature trail that was really connecting the city. This was a priority to the community. Again, this is just one example of how this is done. Our finest task as a network is to really make sure that we document all of this so that when we have these conversations that we are having today, we can also share with you how we're investing in prevention and how it's done, not just in the region, but also across the region. So colleagues, I think there are 3 key messages here. So I think many of the challenges that we face in today's world are challenges that cannot be tackled by one sector alone. The Healthy Cities Network has been around for 35 years. It is very strategically positioned to tackle those challenges. And of course, in order to ensure that we don't leave anyone behind, it will be essential to draw from the lessons learned from the Healthy Cities Network, but also to further grow the network. We very much take this as an opportunity to invite you to become part of the network and again draw upon the rich experience from colleagues who are here with us today, such as Denise, and again tap into the wonderful network that we have that consists of more than 1,900 cities that have core expertise on how to really invest and apply that prevention agenda. And we believe that this is really the best way to again ensure that we leave no one behind. And with that, colleagues, I'd like to thank you for listening